Now I invite Dr. Sathyan to present on established glaucoma, drops, mix, or trap.
Uh, Thank you, Dr. Girija, and thank you for this wonderful opportunity to be with you all. Dr. Jayashree, do you do SLT routinely in your eye vision center? So availability is an issue. In spite of you being a glaucoma person, Anup is not willing to give you one. Okay, so let's see why. So how many of you are really willing to do SLT here? Is it that you are convinced with her talk? How many of you are really convinced with the talk saying that SLT is a better option than your medications? Only one? Okay, two. So, okay, so it is important that whatever she has presented is true, and then we have been doing SLT for several years. In primary open angle glaucoma, provided that you have done a proper gonioscopy, primary open angle glaucoma, do SLT, it really does very well. So in case if you want to really invest in, it is not a bad investment, provided that you have an adequate number of cases to be done. So let's see the established glaucoma. I don't have any financial interest for this particular topic. So you do all this before you really just establishing a glaucoma is the most simplest thing in today's practice is IOP, fundus change, glaucoma. So that is not the end of the story for you to treat glaucoma. It is much more than that. Please understand, you have to take a detailed history, proper ophthalmic examination of all that, and you need to have the CCT, OCT, fundus photography, and the visual fields. It is no more just that you have to do it for glaucoma patients. It gives so much of an information. Is it glaucoma? Is it not glaucoma? Does the patient have any risk factors? Is the patient progressing? Or is the patient having any other associated illness? So for all this, you need to have all this fundus photography and other investigations like OCT, fields and other things. So the second factor is once you establish the glaucoma, then you need to understand what is the stage of the disease that patient has and what is the patient's preference. How many times have you ever asked the patient, are you willing to use the medication? Just, we are all only the masters. We don't listen to you. We say what you should do. Are we not really too rough to the patients? We never consider the patient as a patient or a human being itself. We say, I tell you do this, that's it. So that is why we have a poor follow-up rates and also poor compliance as well. We don't know how much is the tolerance and other things. So once you really kind of establish the glaucoma, so there is a broad guidelines I'm giving you here, like IOP of less than 30 or 35, where the medication can really work. If anything more than 35 or so, the medications, single medication may not really work. That is the basic concept that I've given you here. So if it is over 35, then you treat with your Diamox and other methods, then bring it down to 35. So once you have brought it down to 30 to 35 below that range, then you have the options of, you have a medical, you have the lasers, then you have the mixed procedure, then you have the trabeculectomy. So once you have the disease as mild to mild, how many times you have done the staging of the disease in your practice? Have you ever done that? If you have not done, please start doing it from today. Do the fields, do the OCT, do the fundus photography, understand, make sure that then comes your MIGS or the trabeculectomy option as only as the secondary options. It is not going to be your primary choice ever. So looking at the medications, it is always our first choice in our practice. Once you diagnose the patient as a primary open angle glaucoma, then you have the choice of both medical as well as the SLT as the primary choice, first choice itself. Medication is definitely non-invasive. It is titratable, then it brings down the IOP to a very critical, whatever the levels that we are kind of expecting. So all stages of glaucoma it works, and any type of glaucoma it really works. And so that is the reason why we all start with the medications. But once you expect the patient to be going to be very poor compliant, so I was just telling George that in our own population, the compliance of our medical management is after 1 year is only 20 to 30%. The 70% of the patient, they don't apply the medications. So how many of us have realized that? Most of us have not realized that. Even though we have realized, have we changed our pattern of treating the disease? We have not changed our pattern of disease because we are arrogant. We just follow what we feel that patients should follow. So that is not a good idea. So SLT definitely has a role to play in all our practice. But for doing SLT, you have to start practicing your gonioscopy. You must do gonioscopy in every given patient. If you don't do the gonioscopy and if you're going to diagnose the patient as a primary open angle glaucoma, you are at 100% fault. As an Asian country, we do have equal number of angle closure disease. So you must understand this. So doing SLT is good, provided that it is only a primary open angle glaucoma. So SLT works perfectly well, 360 degrees. It is not that, okay, you do 50% today, the remaining 50% later. It is not so. You got to do 100%, one full 360 degrees you have to do to get the results. SLT can be repeated and it gives you decent results. It is equivalent to 1 PG analog where it can reduce to 30 to 35%. And the progression, what we have seen in the post SLT eyes is very, very less. The reason is the fluctuations are lesser. The medication group always the fluctuations are higher. That's why you tend to see the progression happening in the medication group. So then we have the secondary option as MIGS because it is catching up much faster than what we all have expected. It is much, much faster. If you really look at Arvind also, each center has, of course, the different levels of MIGS procedure done. Tirunelveli has the highest, I think. Then comes Madurai, Tirunelveli, Coimbatore and other centers. So MIGS definitely, as of today, we are going to focus only on the mild to moderate glaucoma because it has its own set of other advantages in other stages of the disease. But as of today, we keep teaching only it as a mild to moderate disease where you feel the patient's compliance is not good. You can go for it. Or even if the patient says that I don't want to use the medication, you can still have the choice of going in for an MIGS. So that is the best option, but provided that only mild to moderate stage of the disease as of today. Looking at the trabeculectomy, it perfectly works in every given type of glaucoma, every given stage of the disease. But in general principle, we never do the trabeculectomy as a first choice. If the patient's compliance is poor, in spite of using the medication, the target IOP is not achieved, there is a significant progression happening. Then if you feel the stage of the disease is moderate or severe, and if you don't know how to do an MIGS procedure, trabeculectomy is still holds the better, is the best choice because it has the maximum IOP reduction in all kind of glaucomas. So looking at the comparative merits, trabeculectomy holds the highest, then comes your SLT and MIGS. Drugs, quite variable, single drug, 2 drugs. Combinations doesn't work in the same way of what we think all the time. One drug may work for some time, the other drug may work for some time, both can work for some time, both may fail at some time. So it is quite variable. So you'll have to understand there is a stepwise algorithm given, but it is too elaborate a chart that we are going to give it to you when you are coming for GSI at Patna in October, November. Will give you the dates when it is going to be. So this is a chart which you can really use it. You can put it up in your clinic. This is a very, very elaborate chart which we have done. So we'll soon give it to you. So the take home message is drugs works good, but don't be arrogant to the patient. If the patient is not willing to use the drugs, if you have a SLT, that is again the best choice. Start learning your MIGS procedures. It is definitely a way out for mild to moderate glaucoma. TRAB always as a gold standard holds good for all kind of stages, all types of glaucoma. So that is the take home message for this very short talk of 10 minutes.